The Rooted in Evidence Grant Program is a program for food banks to be able to have specific funding for evaluating innovative nutrition programs. The funding for food banks is often for nutrition programming. However, they do a lot of innovative work. And so the Rooted in Evidence Grant Program can provide specific funds for testing the efficacy and the efficiency of those innovative programs to make sure that they're spending their efforts, their time, and their funds in a way that maximizes the impact for people.
The Food Bank of Eastern Oklahoma serves 24 counties on the eastern part of Oklahoma. We serve many individuals in, day out. The program that we did through Rooted in Evidence is a frozen meal initiative that we provided chef-crafted, healthy, nutritious, and delicious frozen meals to about 150 students for about a year worth of implementation. And the students absolutely enjoyed it, loved it, and we're excited to share our results with Rooted in Evidence.
The Redwood Empire Food Bank services 5 counties actually, and our mission is to end hunger. The program we evaluated was focused on the veteran community. We did a deep dive into the Sonoma County veteran population and wanted to understand their needs and better meet them through food distributions and offer opportunities for veterans to volunteer with us as well, and for us to build relationships with military service providers. We ended up naming it towards the end of our project, Operation End Hunger. This was our opportunity to focus on that group and make these new relationships and better meet the needs of that population group.
The Rooted in Evidence grant was evaluating our fresh food program. We are purchasing food from local farmers and distributing it through our food share events to our clients. We are hoping to be able to measure the impact of having nutritious fresh food accessible and available to our clients who are in need, to be able to make a shift from food security to nutritional security focus.
I'm with the Central California Food Bank. We're located in Fresno, California. We serve over 5 counties, and we have various programming ranging from child hunger programs, which serves our school districts, to farm workers, to senior health programs as well. We really feel it's important that the programs that were created are rooted in evidence and center the voice and choice of our neighbors. High quality programming in regards to programmatic standards is extremely important so that we're not regenerating harm and we're understanding what our impacts and our intentions are on our communities.
The prescriptive nutrition program provides food access at the point of medical care. So rather than having the client come to the food, we bring the food to the patient in the clinic setting. This was really an opportunity to bring some structure and bring the larger conversation around the concepts of higher level data analysis to our food bank. I think that's important because too often we make decisions in the food bank based on anecdotal evidence and personal experience as opposed to really asking the hard questions and making decisions based on what they think as opposed to what we think.
Second Harvest Food Bank has existed since 1986. We are a partner with Feeding America. The program we had evaluated through Rooted in Evidence is the Backpack for Kids program. Bags given to children every 2 weeks to take home for the weekend. That particular program had become stagnant. They felt like the backpack program it pretty much had its legs, it was maintaining itself. But 20 years in, it was just an entangled mess where it needed attention. We learned through the evaluation period that a lot of assumptions we had that were considered problems weren't really the problems. We needed to survey our teachers, which are our stakeholders in the school system, as well as communicate with families about what food types they wanted, if it was a burden or a benefit.
The Center of Nutrition provided a lot of guidance. It was never hand-holding at all. It was always a nudge in the good direction, letting us do the work and making sure we knew for a fact how to implement, how to evaluate programs. They were just a great teacher overall for the program. We learned from the program, from the Frozen Meal Initiative, the students absolutely enjoyed it. Having data that can inform our decision-making processes for our program is exceptional. Through the Rooted in Evidence grant, we secured $285,000 worth of funding to continue implementing frozen meals, and we wouldn't have done that without the Rooted in Evidence grant, because we had the data to provide the funders and sponsors right then and there, and they absolutely loved it.
Highlighting preliminary analysis does show that our provision of help is very helpful, and people appreciate that we do provide over 40% of fresh fruits and vegetables. And throughout our evaluation, that was our biggest question: if we were meeting this veteran community with the right food and our provision of help, and also how we could improve our relationships. We never really focused on evidence-based, and I think that's our biggest learning opportunity and aha moment for our food bank, that we have measures to look and use to evaluate our results. There's impact to how people respond.
What we're going to change is understanding that collecting data from our neighbors can be extractive. What are we doing to create trauma-informed approaches that really center the empowerment of our neighbors based on the feedback we're getting from Rooted in Evidence?
We should be evaluating everything, building it into our programs and our processes. Evaluation should not be a separate, standalone thing for people to be afraid of. It is really key to success of your programs and your processes. Our neighbors loved the opportunity to tell us what they thought about various things, and we learned that our processes were not serving our neighbors in the way that we had intended and that we expected them to. And that actually resulted in major program changes that we'll be implementing this fall.
What we have learned is the importance of measuring data and making choices and program changes based on evaluation as opposed to intuitively guiding ourselves. Rooted in Evidence has really been foundational in facilitating for us so that we can facilitate for our clients.
The devil's in the details. You want to make sure that everything that you learn, you expound upon that and continue it, and then branch it out in the different programs that you have in your facility. It's important that the food banks receive the funds simply because we can throw food anywhere, but what does that mean? The data gleaning and the skill set to be able to receive that data in and actually extrapolate it and see what to do with what you're learning, that's key. And then it's future dollars well spent, and it's a benefit for the whole community.
Through the work that we are able to do with the grantees and that they are able to learn from each other, they leave the Rooted in Evidence grant program empowered to impact their communities above and beyond the time that we have together. The skills our grantees have gained will have ripple effects throughout their communities.